Hey, so I'm Kathy Boyce and I'm just going to do a little video just to show folks who might be interested in using silver fluoride during these days of COVID-19, a little few hints and tricks that you can use silver fluoride without having to use any aerosols. But because we are using silver fluorides, I'm just going to run through just very quickly, show some of the chairside assistants that I've got in the Armour range. Now these are all downloadable. So a lot of people have seen the pediatric one, which was this one here. I'm not very organised, so we're doing this on the fly. This is the pediatric one. And it helps you explain to parents what is going to be going on. The back side here has got the photos of how the action, what it's going to look like, and so they can sit and read that. I've also got one for the hypermineralized teeth, and that goes through that. And recently, the most recent, as of last night, addition to the fold is the one for the adult patient. Because I really believe that right now we're going to have a lot of opportunity to use silver fluoride where we don't have anything else, and nothing else is going to be able to be a stopgap measure or a controlling measure at this climate when we have active caries or extreme sensitivity. We need something to deal with the patient which will fit in with the code 3 and level 3 and level 4 guidelines. So this is the latest one. I've also got here a brochure, patient brochure. There is one for the pediatric one too. These are all on the website. You can download them for free. I would suggest that you do them in colour though, because that gives the patients the true reflection of what's going to be happening to their teeth. And they can take that home, because the Armour approach is actually something that you do. It's an approach and it's a clinical pathway. So if you're putting silver fluoride on, then the parents know that you'll be getting them back to review it. And then you're going to work out the long-term management. But in this instance, this is where we're needing to go, if you choose that to do for your patient. One of the things that I really strongly suggest though is at the end you give your patients one of the post-treatment cards. Now again, this is just so that they can have that with them, they can take that home, and what they can do is then, if they don't go back to you, because there's a lot of people turning up for emergencies to clinics that they've not been to before, and if you're using silver fluoride and they don't happen to return to you, but you have a card that you can give them, a little wallet-sized card, then that means that you've actually given the next practitioner a little bit of information. So these are also downloadable from the website. There's two templates, one where you can actually send them off and get them printed, or another one where you can actually print them on kind of thick paper and then chop them up yourself, both of the same sort of thing. Okay, so I'm going to actually now run through an application using silver fluoride but without aerosols on a patient. She's actually somebody that we know, and she has had silver fluoride done before on this particular tooth, but it's just more the technique of how you can actually apply it without having any aerosols. Okay, I'm just going to get my gear on. Alright, so what I'm doing here is I'm just drying this tooth off with a cotton pellet. Normally we would air dry this, but we are unable to create aerosols, and so I'm just drying it as best I can, and it is very effective even with this. Now, because we are using a silver fluoride that is water based, we don't have to be worried about protecting gingiva, and I can really pop that down around there because this is a 6.3 pH. And that's why I like this one. Plus the thing is we can leave it on here for 3 minutes without concern, and the longer application, the more uptake, the better off your result is going to be. So we're just going to leave that there for 3 minutes, and once that 3 minutes is up, we'll be able to pop the Sanus on. Three minutes is ideal. And so that's why we wait for 3 minutes, and I'm just going to mop up now some of the excess and then apply the Sanus to that tooth. And you'll notice there that that begins to run a little bit more black. That extremely black, messy area will not stay like that. It'll be only the areas of the decay. And remember that this tooth had been already treated with silver fluoride, and so you know that this is what it did look like first, and now we're back to it. And we're just giving her a top up to last this patient until this crisis is over and life can return to normal. Now I'm just going to get some Durafat and pop over that. And what I like to do now is just put a holding material on that, and I choose to use Durafat. Now you can use oro-based paste or a cocoa butter or anything like that. I just like to hold it there. In the olden days we used to use a stone adhesive wafer, and what we're going to do here is just now put a little bit of water on there. Now we can't use a triplex, so I have prepared just a little damp cotton. Yeah, I'm just putting some water down there. We're coming. Yeah, that's just enough, just to set that Durafat. And we're done. So